Good evening, everyone, and welcome to the Thrive series. We're excited to welcome you back tonight for the Fall 2021 series. If you've attended before, welcome back. If you are new, we are so happy to have you here. The Thrive series is a collaboration between M Health Fairview and the Masonic Cancer Center at the University of Minnesota. Today is the fifth and the last of our regular sessions, and we will have one final breast session on October 26th. Tonight, we will be hearing from the M Health Fairview social work team. This group of fantastic women will be discussing the psychosocial impacts of cancer experienced by many survivors, emphasizing the benefits of connection and support. And now I will let our speakers take it away. Thank you.
So my name is Sherry, and I'm going to start off by giving a brief introduction about our presentation. So tonight we're going to be talking about the history of oncology social work, the psychosocial experience of cancer survivorship, the role of social work in survivorship, as well as screening and self-advocacy. Next slide. So I'm going to begin with a brief overview of the history of how oncology social work has developed. So social work was an expanding profession in the 1940s, employing college and graduate school trained medical social workers in hospitals as it became part of the standards of practice encouraged by professional organizations. Traditionally, the diagnosis of cancer and its prognosis was withheld due to the stigma and fears attached to it. The idea of never telling disallowed providers to talk about their patients' feelings, how they were coping with their illness, and the possibility or threat of death. So the more treatments that became available to treat cancer, it brought on more concerns about the patient's right to informed consent, patient autonomy, and debates on disclosing a cancer diagnosis became part of the public discussion. In the last quarter of the 20th century, patients' right of access to information, partnered with the reduced stigma attached to cancer, encouraged physicians into having more open discussions about their patient's diagnosis. So this change permitted the first formal psychosocial studies of patients in the 1950s. It was the beginning of research into coping and development of interventions to improve patients' quality of life. So due to this change, social workers became the first profession alongside physicians and nurses to attend to the psychological and social problems of cancer patients and their families. And to this day, social workers continue as the frontline in clinical care as important researchers in psycho-oncology. So oncology social work fully evolved in the 1970s as a result of the physician's need to have a member of the healthcare team who understood cancer, treatment, and then the patient's need to address their psychosocial needs. This was a profession that was designed to promote the patient's best utilization of the healthcare system, the optimal development of coping strategies, and the mobilization of community resources to support maximum functioning. Between the years 1983 and 1984, the National Association of Oncology Social Workers, now referred to as the AOSW, became an organization in New York City. This was launched through the support of the American Cancer Society. Today, oncology social work is a fully developed profession with its national organization that provides education and support to the oncology social workers' use of multiple psychosocial interventions for cancer patients and their families. So the key role of the oncology social worker is to assess the patient and the family care needs, as well as provide interventions that help patients work towards solutions that address their physical, intrapsychic, interpersonal, and environmental problems. Next slide, please. So the values and practices from the beginning of medical social work continue to impact oncology social work today. So values such as the importance of being an advocate for patients' point of view within the medical system and in the community, the importance of understanding the cancer disease process, and participating as a team member with physicians and other health professions, as well as many more that align within the social work core values. And those values can be found in the description of standards of practice in the AOSW. Next slide. So one of the main cancer pioneers that helped develop social work or oncology social work was Jimmy Holland. So she was a psychiatrist that had been interested in studying how people with otherwise good mental health reacted emotionally and psychologically to life-threatening illnesses. She named this practice the psychological care of the medically ill. She was a huge advocate for supporting the emotional and psychological needs of individuals with cancer and made a lot of progress in reducing the stigma around cancer. She also encouraged oncologists to include questions about the patient's quality of life in their data collection and research. And although measuring things like anxiety, depression, and fatigue were challenging, Dr. Holland created tools that were designed to measure what patients were feeling. This went beyond what the doctors and nurses were able to identify or assess. This helped validate whether or not the psychological treatments were working. So her research actually brought the emerging field of psycho-oncology into the realm of evidence-based science, which allowed it to become a recognized subspecialty. Next slide, please. So now that we've learned a little bit about the revolution of oncology social work, we're going to get more in depth about how social workers can be helpful for patients in survivorship. But before we do that, I just wanted to define what survivorship will mean throughout our presentation. So according to the American Cancer Society, survivorship is defined as anyone who has ever been diagnosed with cancer, no matter where they are in the course of their disease. And although we acknowledge that everyone has their own definition of what survivorship means for them, for this presentation, we'll be identifying survivorship as any patient who is no longer receiving treatment or active treatment and is considered to be in remission. So now that I've clarified that, I'm going to pass this on to Allison, who will discuss the psychosocial experience of cancer survivorship.
Awesome. Thanks, Sherry. All right, and thanks again, everyone, for joining us this evening. So we want to focus on connection in survivorship. And so a good place to start is, what is the experience of survivorship? Again, it is different for everyone, but we kind of want to just highlight some different areas that people could experience. And so Atul Gawande said, "We've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it is larger than that. It's to also enable well-being." So a big key here that we as people are so much more than just our physical being, our health and survival in a sense, but we must also nourish our emotional well-being. Our minds and our bodies are all connected. So just treating the physical cancer in our bodies and not focusing on the mind is doing such a disservice. And to think about it too, our minds and our bodies are connected, but we as humans are connected. We're connected to one another, to our friends, our families, work, colleagues, environment. It could be school, if you really think about all the ways that we are connected. And so what is connection? Well, Brené Brown defines connection as the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they derive sustenance and strength from the relationship. I'm a big Brené Brown fan, and she's done really amazing work in studying the value of vulnerability in connection to one another. And so tonight, in my little section, I'm going to be talking about more of the vulnerable aspects of survivorship, of things that people can experience. So next slide, please. Okay. So let's go back to the beginning. When you're first diagnosed, there's just so many thoughts, so many feelings that run through people's heads. There's the feelings of shock, fear, wondering, what will I feel like? What treatment should I do? What side effects will I have? Is this going to work for me? There's arrangements to be made with jobs, meals, transportation, sometimes childcare. Patients quickly become enmeshed in this world with their clinic and with their doctors, providers, leaning and offering on getting support from their family and friends, just really surrounding you with when first diagnosed for so many people. And then all in hopes of completing treatment to come out the other end, and go into this next season. And so we get to this chapter and this time of survivorship, and then ask maybe, then what? It's kind of adjusting to a new normal in a sense. One patient's experience was described by Sandra Blackburn, LSW. She states, I once congratulated a patient when she informed me it was the day of her final chemo treatment. Her response changed my perspective on how I approach such transitions in care ever since. It was not a time of happiness or accomplishment for her. She said she felt as if she was being set adrift. And I just thought that was a really good picture, because without realizing it, we all tend to have expectations. And, what expectations were there, for this season, this next chapter of survivorship? And as so many of us know, expectations don't always turn out like we think or we hope them to. Our feelings, our inner feelings, may not always match the outer reality of what we expect to feel. So kind of the joy and celebration of ringing the bell of the last day of treatment, but maybe inside not feeling adrift or feeling lost, maybe potential feelings of afraid of change, asking yourself, now what? They're really, for some people, can be a lot of security and safety in the regular routine of appointments and knowing your providers, your nurses in the clinic. And so that goes away, and kind of asking yourself, okay, what is this new normal? Next slide, please. So a lot of people really tend to feel different sense of shame or guilt. Um, there's this guilt that you're not necessarily back to normal, quote unquote, right? So normal of how you felt maybe prior to being diagnosed, thinking, okay, I just need to get through this and I'll go back to the way things were before. And if that doesn't necessarily happen, or you don't have that expectation isn't met, sense of shame or guilt, or why do I feel this way? Some people feel like a burden to their loved ones, or they needed more help or expected to have more energy at this point, or maybe even internalizing, okay, my loved ones think I should be better, think I should have more energy than I do, and feeling guilty about that. We hear that quite a bit from so many patients. And just want to acknowledge that feelings are just feedback, but often there are expectations about what our feelings should be. And many straight patients struggle feeling that because they're not like grateful that they're somehow doing this experience wrong. And that I just want to normalize the sense of guilt and shame that so many people feel, because there's no such thing as doing this wrong, and feelings are not necessarily right or wrong. They are, and it's that's why we need to talk about these things and normalize these feelings that so many people have, so we can remove that stigma and people can get connected and get support. Next slide, please. Okay, another area of change that happens in survivorship is, when people first get diagnosed, some people really experience family, friends, coworkers, so many people coming out of the woodworks to express their love and support and offering help. But then in this, time goes on, you finish your treatment, and maybe your support system has gotten distracted, or they don't necessarily know what you need right now, or if what would be helpful, and just feeling like, okay, where did my support system go? Or even your providers as a support system, and not having those regular appointments like we were just talking about. Sometimes people tend to feel like they need to appear strong, try to hide vulnerabilities, any sort of effects from their treatment, or put those expectations on themselves of how they should be. Or maybe people experienced a lot of support and favors and then feeling like, okay, I should be in a position now to repay. And that is not necessarily the case. And then, of course, it would just be silly not to mention this extra layer of impact that the COVID-19 pandemic that we're all experiencing has had specifically on cancer survivorship, just with the isolation, the greater sense of feelings of vulnerability. And feeling vulnerable is hard. Feeling disconnected and isolated in this pandemic is so hard. We've all been forced to find new and creative ways to stay connected to others, and that's just an added layer that so many of our patients experience. Next slide, please. Okay, work and finances. That is probably one of the biggest stressors that so many people mention, right? Worried about paying medical bills, loss or change in income from taking time off work, or a caregiver taking time off, no longer having that PTO that you had built up for this time, changes in insurance, or gaps in benefits can really create a lot of fear for people. And maybe that might not have been on the forefront of your mind in the beginning, again, in that let's do the very next thing. And now worrying a little bit more about what is this going to look like for me. Also, so many people experience having to adjust loss of employment, or what does returning to work look like for them. So many of us, all of us, ask ourselves, how is my identity connected to my work? How has my career priorities changed since being diagnosed, since this happened? Also, there's a sense of returning to work. How do I do that? So many people don't realize that employers are legally obligated to make accommodations for them. And it's hard to ask for help, hard to ask for accommodations, but it's so normal. And it's just want to validate that that's perfectly okay. And how can you go about doing that? There's the sense of sharing with the news with your coworkers. What do I tell them? What do I not tell? Sometimes managing treatment side effects, and then also adjusting schedule, things like that. So that's a big piece, a big component. That's not just your physical well-being, right? But your life, and how has it been impacted by going through cancer treatment. Next slide, please. Okay. Body image, fertility, and intimate relationships. So many people experience changes to all of these things, and I just want to primarily focus on the left hand side. A quote on there: cancer can have a number of effects on sexual health. According to one poll conducted by Livestrong, nearly 60% of cancer survivors report experiencing sexual dysfunction after treatment. Also, a high number of survivors reporting long-term concerns regarding physical intimacy. There's also just such a lot of changes that people experience in relationships, from caregivers role to being from a spouse to a caregiver and patient. All of those changes and changes to our bodies and intimate relationships, they are kept too often as taboo topics. And these are such a huge part of our well-being and who we are as humans and connection to others. And so I just want to remove the stigma and take this away as being a taboo topic. And there is support out there in connecting to others about what so many people are going through through this. All right, last slide. Next slide. And then big piece, right? Not just physical health, but mental, emotional health. And so the depression and anxiety, post-traumatic stress disorder, Fear of recurrence and return to work and financial issues are among the psychological consequences of living beyond cancer. Typically, these conditions are underdiagnosed and undertreated despite the availability of effective psychosocial and drug interventions. And so, a big piece here that I just want to highlight in this quote is it's often underdiagnosed and undertreated, but there is availability and support out there. Next slide. So let's explore a little bit more about what that could look like in regards to mental health. So I loved this image because it shows both the physical signs of depression and anxiety, as well as some of the mental emotional symptoms of depression and anxiety. So physical symptoms, increasing heart rate, chest pain, poor sleep or poor appetite, feelings of restlessness in your body, and then some of the emotional signs and symptoms, perseverating thoughts of death, of suicide, or harming yourself, times of being unable to stop or control worrying, loss of interest or pleasure in doing things. And so there's physical side effects of cancer treatments, right? But where is the physical effects in regards to depression or anxiety, or is it all just interconnected? Really, it's all interconnected. It's not just one or the other. And so a big piece that I just want everyone to do a little bit of a self-check. Are you noticing any of these things? Are you noticing it getting worse over time or happening more days than off or than not necessarily? Are you having intense fears of recurrence that are impacting your life and ability to function in everyday life? That's important to do some of those that self checks, because just because this is so common, um, doesn't mean that it's normal and doesn't mean that this has to be your new normal. Up to 60% of cancer patients may have symptoms of anxiety or depression that don't necessarily meet criteria for a diagnostic disorder. And so you don't need to meet criteria for a mental health diagnosis to feel like you could benefit from additional support, resources, and interventions that are available. So, talked a lot about a lot of really hard things that people feel and experience going through cancer and coming out to cancer survivorship. People often think that they are supposed to be happy in this stage, and that's not necessarily true. We want to reduce that stigma, normalize, and try to connect people together. So now I'll pass the baton off to my colleague Eleanor, who will explore a little bit more about how we can help you and support your loved ones through this time.
Thank you, Allison. So I'm here to talk about the role of social work in survivorship. Next slide, please. So when we think about the role of social work, we think about people who come in with a real practical approach to what is occurring for patients. We can provide many different interventions. We can provide mental health assessments. So if you are experiencing those symptoms that Allison referred to, having ability to talk to somebody about, hey, this is where I'm at, this is how I'm feeling, and we can intervene and help with coping, adjustment. It could be referrals for ongoing counseling, support groups, mentor or patient matching programs. So there are many different avenues that people can pursue to really get the support that they need. We can provide crisis intervention. When we think about a person undergoing treatment for cancer and now being in survivorship, it's not as if their whole other entire parts of their life disappear during this time. There are things that happen that are unrelated to the treatment for cancer. Some are, but crisis can occur. And so the social worker in the clinic that you go to can really provide a listening ear, someone who could really sit down and say, okay, let's talk about where things are at. Be a supportive person, a non-medical person. We're never going to come and ask to draw your blood, of course, but somebody who is can be a source of support. We can also help with very practical things like community resources, chore services, transportation, meals, support groups. All of these things are areas where we can definitely talk about options for you, and you can decide which are a good fit for you or not. We're mobile. The folks that are at the clinic and surgery center, of course, stay there, but the folks that are at other clinics do move between clinics, so they're available on different days, but I do know that they do go and see folks on days that they're not supposed to be at that clinic because a need arose and they got a call. So definitely reach out, ask for help, because we're here to provide that. Next slide, please. So one of the tenets of social work practice, what you learn on the first day of school when you get there, is we start where the patient is at. So we don't come in with a preconceived idea about how a person should be coping, how they should be feeling. All of that is very much determined by the individual patient. So part of our role is to sit down and talk about where you are at with the treatment, with the survivorship. Where are your family and friends at? If that is a concern as well. One other sort of cornerstone of social work practice is looking at the person and environment. People do not exist just in the clinic, exam room, or in the hospital. They live a rich, robust life outside of their cancer treatment. And we, as social workers, take all of that into perspective. We take the medical piece, we take the mental health piece, we take the social piece, and we really focus on the complete person, which leads to the next item. So our lens is focused on the whole person. Patient experiences are so much more robust than just the cancer treatment. So again, we want to make sure that we're focusing on all aspects of a person's life. We do need to consider all aspects as well, because if we're going to work together to solve a problem, for example, or an issue that you've brought up that would be helpful for us to talk about, we do need to look at all areas, just so the solution that we come to together is practical and we want it to be successful. So it's important to look at all of those different aspects. We're very practical in our problem solving. I like to think that we focus on, the person, what their needs are. Together, we come up with a solution. A lot of that is us just offering what's available and the person deciding what's a good fit. Always, 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 it can be reworked. There's no one right way to do this. As Allison pointed out, there's just your way, and your way changes based on needs and how you're feeling and other concerns in your life. Social justice is also a core principle of social work. So we are advocating for fairness and equity. We're looking at underserved or underrepresented populations. We're taking into account people's financial situation, their ethnicity, sexual orientation, gender identity. Are they uninsured? We really want to work to reduce health disparities and address cultural, economic, geographical barriers for folks. And then in addition to all of the problem solving that we do, we are also clinically licensed to provide mental health interventions. So really a well-rounded person to have on your team. Next slide, please. So this year, the Association of Community Cancer Centers president is a social worker. She works at Providence Health and Services. Her year-long initiative will focus on 3 key lessons. So health equity and social justice, as we just talked about, critical drivers of quality cancer care, and they need to be practice-based solutions, really looking at what are the barriers and how can we improve health outcomes. We really need to focus on high impact psychosocial and supportive care services. I think if the last year and a half has taught us anything, is that we need to be flexible about the way that we provide care to folks, and we need to work within the constraints that we have. And we've learned that there are many other ways to reach out to folks and provide impact. And then we also need to work on strengthening a culture that supports well-being. So resilience, so if we think about resilience as the capacity to recover quickly from difficulty or difficult situations or toughness, we really need to, both on the provider side and the patient side, work on skills on how to be resilient. Next slide, please. So within our social work colleague group, we have about 90 years of experience. That's in hospitals, palliative care, skilled care nursing facilities, hospice, pediatric oncology, private counseling practice. So we have a robust group with just a lot of skills and expertise. So even if I don't know exactly how to help a person, I have many colleagues I can reach out to, and we can collaborate and find the best options to provide so folks can decide what's a good fit for them. Next slide, please. We're going to take a short moment here to do an intervention. This is an intervention that we use. I work in the bone marrow transplant clinic, so we use this intervention when we work with folks who are having a bone marrow biopsy. For other folks, it can be a way to help with depression or anxiety, post-traumatic stress. Meditation, guided meditation, is something that's available in many different settings. There are apps that you can get on your phone, YouTube videos. You can attend seminars on this. What I generally tell people is it's like learning a new language or a musical instrument. It takes some practice, and you may not necessarily find it to be a great fit the first couple of times you try, but I always say, try it a few times and see if it's just finding the right script, or sometimes the voice on the recording isn't always a good fit as well. So give it a chance, see what you think. We are going to together today do a meditation on on loving kindness. It'll take about 4 to 5 minutes. So settling back in your chair, closing your eyes if you're comfortable with that, allowing your body to sink into the surface under you, noticing if it feels soft or firm, noticing if the surface feels warm or cool. Gently inhaling and exhaling as you settle into your chair. Today, we are going to learn about the practice of cultivating positive emotion, in this case, loving kindness. This is the desire for someone to be happy, or for yourself to be happy. It's not dependent on something. It's not conditional. It's just a natural opening of the heart to someone else or to yourself. First, we're going to extend loving kindness to ourselves. Perhaps thinking of yourself as you are today, or a younger version of yourself. Extending to yourself the following words that you can alter to words that fit better for you. May I be safe and protected from internal and external harm. May I be free from pain and suffering. May I know peace. Repeating that again. May I be safe and protected from internal and external harm. May I be free of pain and suffering. May I know peace. Now, extending that loving kindness to someone in our lives that we care for. This could be a person, or perhaps a companion animal, someone that brings warm and supportive feelings when we think about them. Extending to this being the same statements of loving kindness we extended to ourselves. May you be safe and protected from internal and external harm. May you be free of pain and suffering. May you know peace. Repeating again, may you be safe and protected from internal and external harm. May you be free of pain and suffering. May you know peace. Ending our meditation together today by focusing these feelings of loving kindness and acceptance back toward ourselves, knowing that we are deserving of these sentiments and learning to accept them for ourselves. May I be safe and protected from internal and external harm. May I be free of pain and suffering. May I know peace. May I be safe and protected from internal and external harm. May I be free of pain and suffering. May I know peace. And when it feels right for you, coming back into the room that you're sitting in, again, noticing the surface that you're sitting on, grounding yourself in the present, bringing along with you these loving kindness sentiments, remembering that you're able to practice this whenever feels right for you. Next slide, please. There is an undeniable mind and body connection. And imagination is a powerful tool, and through imagery and calling upon previous experiences, we're able to elicit a response from our bodies. It takes practice. These connections can help us cope with anxiety or depression or post-traumatic stress. They can improve our well-being, which then impacts our physical health. They allow us a chance to quiet our minds. All right, thank you, and I'll pass it along to Ellen.
Thank you, Eleanor. I have the great fortune of going after Eleanor and having a lovely mindfulness. So thank you for guiding us in that today. I know we have talked a lot this evening about common psychosocial concerns that surface in survivorship, as well as the role that oncology social workers can play in supporting you. And I would love to spend this portion of the presentation thinking a little bit more about what we can, or I'm hoping that you can take away, feeling empowered to recognize times when you're in distress, and feeling that you have the tools, which we know that you do, to be an agent for change for your care needs. Next slide, please. So this slide depicts the importance of early and ongoing collaborative dialogue between patient and care team in identifying concerns and needs, making a plan, addressing the plan, making sure that there's that the referrals are going to the right places, and then evaluating that. So this comes from a 2007 report by the Institute of Medicine, which called attention to the unmet psychosocial needs of cancer patients. I'm just going to read this language here because it's monumental, really. Attending to psychosocial needs should be an integral part of quality cancer care. All components of the healthcare system that are involved in cancer care should explicitly incorporate attention to psychosocial needs. So this was the first time in 2007, which I know we're all thinking wasn't that long ago, where cancer care was explicitly thinking about the whole person. So we know that people with earlier, when we're able to earlier address needs, when people are going through treatment, they have better outcomes in survivorship. And so really this is the emphasis here is how do we support earlier on to do better at the end, but regardless of wherever you are in your survivorship journey and experience, we want to partner with you in this kind of way, having ongoing dialogue. I know it has been mentioned a number of times in this presentation that there's no way of doing this wrong? And I would say yes. And there are so many ways of doing it right. I guess it's just the flip side of that is, and the right way is listening to what's surfacing and coming up for you, and having the confidence to have that ongoing discussion with your care team. Next slide, please. Building upon the Institute of Medicine's call in 2007, the American College of Surgeons Cancer on Commission, which is a little bit of a mouthful, or as we call them, the COC, mandated in 2012 that all cancer institutions, in order to be accredited, needed to employ a screening tool, a distress screening tool. So I bet many on this call are just thinking, what is distress? What is that? What do we even mean? How do we define it? And so in our cancer community, we think of distress as a multifactorial, unpleasant emotional experience of psychological, social, or spiritual in nature that interferes with your ability to cope with cancer, its physical symptoms, and its treatment. So it's not a precise clinical term. You're not going to find it in the DSM, but I think it's something that we can all understand and relate to in our own lives. And so the distress screen that's on this slide that you see here is what we have here at mHealth Fairview. So it's just one tool of many that we use to evaluate distress. And so it's something probably familiar to many in this discussion today, where it's asked at the first provider visit. And it's really meant for us as a little way of helping to triage who the best next person is to help support and address your care needs. So I know, as I said, it's one way that we have built within the Fairview system, one tool that we use, but I think it's also really valuable for us to think about what are each of us doing personally to evaluate our own distress when we're at home in our ongoing life. Next slide, please. So I'd like to invite you to ask yourself 3 questions. These 3 questions that are here on the slide. The first being, due to my current stress, is it difficult for me to do my work, get along with other people, or complete tasks at home? Are there any basic needs that would help me get through this time? Now, a lot of times we ask about resources, and sometimes it's hard thinking about what that looks like. And we're thinking about access to food, finances. I know somebody on the chat had mentioned finances being a concern. I know transportation can sometimes be a barrier for follow-up care. Housing support, which we know is difficult in the best of times, and the pandemic has only exacerbated. Access to health insurance. How would I recognize when it is too much for me to handle by myself? I worked with, for a few years, with a survivor who really, she found the visual of the thermometer to be an especially helpful tool for her, thinking about distress in the same way that you think about pain, right? On a scale from 0 to 10. And something that she did was she actually would track her distress. She would write it on her calendar and look for different patterns around times of day or over a couple of weeks where her emotional distress numbers were, just to try to get a better understanding and a better feel for where she was, where her anxiety was in her situation. And she told me that she often found herself asking, what can I do to move from being an 8 out of 10 to a 7 out of 10? What's something that I could concretely change in this moment that would not take the anxiety away, but make it a little bit better? And so I felt like that was just such a profound and helpful kind of idea for this tool, and I think I'm reminded again of just how much I learned from the people that I serve and support. I guess thinking about these questions, I just would invite you to, and whether it's writing this down or telling a partner or a friend, but just start thinking through what might your plan for connection be if you're needing more. Who are the safe people in your life? Do you feel connected with a faith community? Is there a particularly attentive or thoughtful family member or friend? Or who on your care team do you feel like you could voice some of these concerns to? And how might you initiate that contact? What might that look like? Is it a text message? Is it a MyChart message? Is it an email? Is it a phone call? I think really making this as concrete for a plan for connection can be really helpful, because sometimes when we're in one of those spaces of being under more distress, it's hard to strategize, right? So just want to invite you to be thinking about those a little bit now. Next slide, please. So I'd love for us to take a couple of minutes together, because I think that this kind of, I'm impressed with the knowledge and of the many people that are on this call. And I feel like there's a lot that we can learn from each other in navigating this time of survivorship. And so if you feel so comfortable, would love to open up the chat here just to hear a little bit more about your reflections and answers to the following questions. How do you know when you are under more distress? I'd love to know what changes. Do you find that you're more agitated with family members? Can't sleep. Can't think right. Yeah, yes. Sleep is so huge. I think that's one of the first things for many people. I know I've had many people that have shared with me, it's that time right before falling asleep when we're alone with our own thoughts, and the day, we don't have the distractions of the day, right? That can be a really, really hard time. So thank you so much for sharing that. More agitated with kids. Yeah, feeling like we have a shorter fuse, feeling like we don't quite have the same resources and energy to kind of weather the changes that are coming up. Moody, headaches, trouble focusing. Yes. So those cognitive changes, mood changes, absolutely. Yeah, thank you for sharing. Sleep too much. On the other end too. Yes, that can absolutely come up too. Sometimes sleep can be a little bit of an escape for us, right? The times when we're more distressed, sometimes it's that avenue, that place that we can go to get away from it. Yeah. I just would love to also hear, what do you do to care for yourself when you're under more emotional distress? Finding enjoyment. Can't find enjoyment in usual activities, definitely. Yeah. I had a woman that I worked with just last week who was telling me that she really had this desire, in her words, to bloom again. She said that she felt like she had lost her zest for life, which I just was like, oh, it's just such powerful language. What do each of you do to bloom? How do you take care of yourselves? I feel like I'm missing so much discussion that's happening here in the chat. I just want to be sure that I'm seeing pieces too, about what people are doing. Taking a break. Yes, that's a really great idea. Sometimes it's just kind of recognizing, oh, I'm in that space right now and I just gotta take a step away. Walk your dog, belly dance. Oh, very cool. Walking dog, getting out in nature, spending time with animals. It's amazing what kind of energy our animals have. I feel like they're just such great little personalities. Yeah. Get outside. So a lot of people getting outside. Oh. Qigong, great. Yeah. Again, lake water, being in nature, drink coffee in the dark and silence. Oh, what a powerful visual. Gardening, so physical, moving our bodies too. These are great. I just feel like some of the things that I was thinking about adding in, you guys are already sharing. So thank you for that. And we can keep this discussion going as well, and in our closing too, if there are pieces that people are thinking about. But I think sometimes it's that generating of an idea of what to do to get into a different headspace that can be the hardest thing. So that's why I really appreciate people sharing here what's been supportive and helpful for them. So I hope, if people are ever in that kind of space and just thinking, what can I do? Look back and see, okay, gratitude list. Awesome. Yeah. Thinking about all the things that we are grateful for. It's a great way of, restructuring our negative thinking and thinking about all that there is that's good, because there is so much that is good. I think that's a great practice to get into. And acupuncture, yeah, that can be incredibly helpful. There's a lot of literature about the benefits of acupuncture too. So that's great. I think we'll move to the next slide and we can cycle back with this as well. So on this slide, I just have the oncology social workers listed here from our bone marrow transplant over at the Masonic, the CSC that Eleanor was talking about earlier, and our clinic social work sites as well. And we work closely on an interdisciplinary care team. So there are even more members that are not listed here, where we work closely with chaplains, with dietitians, with our psychologists, with palliative care social workers. So really, I hope the take-home message from this slide can be that there are a lot of people that are really anxious to support you with your care needs, whatever it might be that's surfacing. Next slide, please. This image might be familiar to others on this call, but I do think it's worth highlighting here. The Cancer Community Leadership Collaborative, which does incredible work locally. They're a collective of nonprofit health-focused organizations that we have here in the Twin Cities area. And I mean, we're really lucky here in Minnesota to be in such a resource-rich area with people that are so mindful about supporting people that are touched with cancer, and also collaborating with each other to make sure that there are a lot of combined efforts, and it happens all the time with these different organizations. This is to say, this is by no means an exhaustive list of all the resources that social work helps people to get connected with. These are just a few of the really common, wonderful places that we have locally. So if there's a concern that's surfacing that Allison had talked about earlier, that you wonder about whether or not it might connect with one of these groups that's on the screen, and I mean, just let us know, reach out to us as social workers. We're happy to help kind of think through what might be a next connection. And then the next slide here. So I'm imagining that many people that are in this discussion today are already part of the Survivorship listserv, but I just want to give a plug for continuing to check in on our Cancer Survivorship Program resource tab in particular, because we're doing a lot of work right now as the social work department to help support and bolster the resources on this tab. So thinking a lot more about not just local resources, but national resources that are available for support too. Thinking about common concerns like building strength, supporting fertility, enhancing social connection, navigating that transition back to work that we heard a lot about with Allison earlier too. So really keep an eye out for that resource tab. And then next slide. Yeah, so just wanted to open it up for questions. We're just so appreciative of having a space together today to talk about common concerns that surface, and would love to answer questions as a group.
I'm on the telephone, but my question is, does most insurance cover a patient for seeing a social worker?
So with social work, in the role that we have, it is considered ancillary services. So it's not an individual charge on your bill. It's more just part of the services that are provided to our patients. If you saw a therapist for a counseling session, that would be something that would be billed to insurance. So I guess
So
how
does one see one of you?
Oh, well, when you're at the clinic that you go to, you can just ask the provider, hey, could you have the social worker give me a call? And they may say, here's their number. You can give them a jingle, or they may just pass the message on to us, and we'll be sure to get in touch.
Thank you.
You're welcome.
All right. Well, before we kick it off for a brief Q&A, I just wanted to spend a little time thanking each and every one of you. So thank you so much, Eleanor, Allison, Sherry, Ellen, and Nicole, for the wonderful presentation tonight, for sharing all the information, the knowledge, the amazing resources and tips, for guiding us through a meditation session, for the history of social work, and just everything that you covered today was phenomenal. So thank you so much. So we did have some questions that came through during the registration, but let's cover some of the questions that came in through the chat. So earlier, a question came in that asked about, do employers need to make accommodations even when you're in remission?
A really great resource to look more into this would be triagecancer.org. Triage, TRIAGE, cancer.org. It is a national organization that divides up their website by topic, but also by state. So you can do a sort of a deep dive. When I saw the question, I went onto the site and I was able to drill down to quick guide to reasonable accommodations. So all the information that you need is there. It, if you're in remission, it would probably be a situation where you'd need paperwork filled out that your oncologist or the nurse coordinator could help complete there. So I would definitely take a look at their website.
Great, thank you so much. So looks like we have the link in the chat box, and then also this will be posted on the website along with some of the other resources that were mentioned today. So there is another question, essentially just about just some financial resources that Health Fairview has available for survivors. If you could speak a little bit more on that and where they can find them.
It's a great question. We have a lot of patients who are in situations where they are insured, perhaps underinsured, or they have other things in their life that require assistance as well. So that impacts their ability to meet deductibles and max out of pocket. It's a very good question. I mean, the resource at mHealth through our organization is through the central business office. And so we're not involved in the decisions that they make regarding the community care, but I think it's a great question to ask, and one that I would be happy to bring forward of, are there other sort of lenses or layers or eligibility criteria that we could use? Because at this point, it's pretty straightforward. It's, do you have insurance? Do you have medical assistance? Do you need to apply? I mean, there's just a very sort of clear decision-making tree, if you will. And I think it's a good question that I'm happy to bring forward. So I really appreciate you bringing that up. I think that's important for us to hear.
Thank you so much for covering that. And so lastly, there was a question that came in through the registration previously. And so this person had just asked, can you speak a little bit more about what counseling looks like after treatment, especially when you realize the Grim Reaper has visited or is near, and the role really of stress in cancer development? You know, this is a big one.
The role of any counseling session is really to talk with you about what concerns you have, your life experiences. A good history, if you will, at the beginning of the session really helps. At the first session or first couple of sessions really help to sort of provide the therapist with the ability to say, okay, this is what you've shared about where you have been, where you currently are, what is important to you to be able to reflect on, to learn skills with how to cope with. So for someone, it might be PTSD. I can't go into a hospital. I can't even go to the clinic. How am I supposed to, continue on with treatment when this is so stressful for me? I have a panic attack. I have extreme sense of anxiety. So then working with the therapist to find skills and interventions that would not remove all of those feelings, of course, but how do I handle those? What skills do I use to cope with it? How can I get through the visit to the doctor, if that was the concern that you had? So I think that finding a therapist that's a good fit for you, thinking about before you go, does gender matter? Does their education matter? Does their experience matter? And really working to find somebody who fits. And then just like I said with the guided meditation, it takes a few times, you know, to learn about a person and for them to learn about you, just like you probably didn't have an instant connection with all of the providers you saw when you first came to the cancer center. It takes time, and it's learning about you. They learn about you, you learn about them. So I think all taking into consideration of all of those things, plus your, you know, coverage with your insurance, making sure that you have that. So, and I'm sorry, I forgot the second part of the question.
Yeah, so it basically just to talk a little bit about the role of stress in cancer development.
I don't know that I have a lot of data to provide on that question. I think that when we think about stress, it does have an impact on us, on all people. It, you know, with the skills that we learn with guided meditation, sometimes stress can be all the voices that we have in our head or the one voice that talks the loudest. And with the meditation, you're able to really quiet that. Great question to ask your provider, you know, the oncologist or the advanced practice practitioner, to see, you know, what their experience is with stress. I just don't. Maybe one of my colleagues would know more about that, or know a resource that they could look at. But I wouldn't want to speak out of turn on something that I don't have the information about.
For fear of us all talking too much, we designated Eleanor as our wonderful spokesperson, and she's doing fabulous.
Yeah, so I think it's good to just speak to your oncologist to get more information on that. So we are out of time for today. So thank you all so much for being here today. We truly appreciate it. We hope to see you again in 2 weeks, because we don't have a session next week. So we will see you on October 26th for our final Thrive session of the season. So have a great night, everyone, and thank you so much for joining. Take care.
Thank you.
Thanks,
Thank
everybody.
you.
Thanks.
Bye now.
Bye.
Bye.